webisode, we're going to address one of the most challenging skin concerns we face in the skincare center and the spa, oily and acne skin. We're going to get hands-on and take you step by step through a professional treatment, and we'll share tips on using different technologies, what kinds of products and ingredients to get the best results, together with showing you IDI's world-famous extraction method. Every professional treatment begins with a written consultation. With oily and acne skin clients especially, you must ensure that there are no contraindications that may affect your protocol. Oral and topical acne medications that are derivatives of vitamin A, like isotretinoin, retin-A, and adapalene, increase cell turnover and may require you to omit or adjust your exfoliation step. Electrical modalities might also be contraindicated if your client has any metal pins or plates or health problems, so safeguard yourself and your client with a signed consultation. Let's start with cleansing. It is important that you always double cleanse. We all have dirtier skins today due to pollution, long-lasting makeup, sunscreens, sweat, and sebum. So one cleanse is not enough. For oily skins, a thorough daily cleansing routine is critical to avoid risk of breakouts due to congestion. Start with applying an oil-based, water-soluble cleanser to dry skin. This literally liquefies sebum, makeup, and oil on contact. Your oily skin clients might be reluctant to try an oil-based cleanser, but it's actually one of the most effective and quickest ways to see visibly clearer skin. To get an even deeper cleanse and mild exfoliation effect at this step, you can introduce ultrasonic technology. Therapeutic ultrasound can be used for deep cleansing or peeling, or for product penetration depending on the device. How it works is that sound waves create a mechanical effect in the tissues, like ripples on water. It causes tiny oscillations to allow for the release of dead surface cells and loosening of comedones. When using ultrasound for deep cleansing, use a blade or spatula type device, holding the blade at a 45-degree angle to the skin, as if to scrape or shave the skin. Hold the skin taut and begin on the neck area using light upward strokes, covering all areas of the face and neck. You're stroking upwards, working against the direction of hair growth to help to break up sebum and debris at the mouth of the follicle, which again is key for oily and acne-prone skin. Try to keep one hand in contact with the client at all times, but periodically wipe debris off the blade with a tissue or cotton round. After covering the whole face, wet your hands to emulsify the oil cleanser. This will lift up all the dislodged cells and debris. Next, perform a second cleanse with a foaming or antibacterial type cleanser for more inflamed acne skins, or a clay-based cleanser for oily congested skins. Some machine options to consider during the cleansing step to expedite results are electric brushes to cleanse and exfoliate in one step, warm steam to relax, warm and soften the skin to make the removal of comedones easier, and at IDI we prefer to steam without ozone as it's now considered to be a respiratory irritant. Now the skin is very clean, you can perform skin analysis. Look for areas of congestion, particularly in typical zones on the forehead, nose, and chin. Feel for under the surface congestion, around the jawline and around the chin. And check inside the ear canal for comedones. Speak with the client to discover more about his or her causes of congestion and breakouts, and assess the skin for inflamed and non-inflamed lesions so you can properly establish your extraction protocol. Exfoliation is the next typical step. Oily and acneic skins benefit greatly from mask-type chemical and enzyme-based exfoliants with ingredients like salicylic acid, sulfur, and fruit enzymes. You might choose to increase the level of your exfoliant with an accelerator, or do an alkaline enzymatic form of exfoliation for tight follicles in a congested skin. Again, warm steam can be used at this time. To ensure painless and safe extractions, ensure the skin is truly prepped. Desincrustation using an alkaline softening solution used either under steam or with galvanic current is another modality to consider. This one foams up to ensure that it stays on the impacted area and doesn't drip on the skin. After, of course, checking for any possible contraindications, begin checking your machine and if necessary, switch to a negative polarity versus positive polarity for iontophoresis. Then place the handheld cover electrode into the client's hand using a damp sponge over the metal for better client comfort and conductivity. Alternatively, use a covered pad and place under the client's shoulder blade. Tell them what you are doing at all times and what sensations they can expect to feel to put them at ease. After placing the active electrode on the client's skin on the area of congestion, turn on your machine and slowly turn up until the client feels a mild tingling sensation. Move over the area in light, small circles and avoid breaking contact with the skin. Using a covered pincer-style electrode helps you to collect the dissolved sebum and impactions due to its small surface area, and it helps you get into tight areas like around the nostrils. Perform desincrustation on the negative polarity for around 4 minutes. Now for the step that we all love, extractions. Ensure you are wearing gloves. We prefer latex-free to avoid any possible skin allergies. Taking a tissue, fold into a triangle and then over your index finger. Twist back to make a nice tight envelope or mitt over your index finger. Taking the tail end of the tissue, secure out of the way between your thumb and your index finger or between your index finger and your middle finger. Repeat this on the opposite hand. Your technique is paramount in providing safe, effective, and hygienic extractions. The IDI signature extraction method ensures that the entire impaction or comedone is removed from the base of the follicle up. As we're using the sides of the fingers and not the nails or a comedone extractor, we can also control the pressure. We're actually using the adipose tissue in the deeper layer of the skin or the fatty layer to help us, and this is why these types of extractions are also painless, even in hard to reach areas. We're going to stretch the skin, create a mound, and slide our fingers actually underneath the impaction. Then rocking and rolling with the side of the fingers, we help to clear the impaction in the follicle from the base of the follicle out to the surface of the skin. Wipe the expelled comedone away from the follicle opening in the direction of the hair growth. We don't want to push the waste back in. This method helps prevent infections, possible pustules, and reduces the chances of scarring. On the sides of the nose, ask the client to breathe out of their mouth and move your working position and the head of your client to the side. And gently support the bridge of the nose with your thumb and bump out the crease by gently pushing on the edge of the nostril rim. See how it pops out? Now rock your fingers and wipe away. In the US, in the state of California, we can only remove non-inflamed lesions. Infected acne can be treated with a topical drying solution like benzoyl peroxide or salicylic acid. After thoroughly examining and removing any impactions from the key areas like the chin, the nose, and the forehead, we now want to sterilize with a post-extraction solution. To reduce any possible erythema on the skin and to help penetrate oil-controlling and acne-fighting ingredients into the deeper layers of the epidermis, we can apply a complex over the skin, an ionizable gel mask, and perform a few minutes of galvanic iontophoresis on the positive pole. Specific iontophoresis with microcurrent is also an option, or ultrasound in the penetration mode. Another alternative or addition is to use high frequency. High frequency is a great technology to use in the treatment room after extractions or on inflamed acne lesions. It has a drying and germicidal effect on the surface of the skin by sending ozone to the impaction. The ozone is quickly broken down into active oxygen, and this helps to destroy any bacteria. The high frequency should be used over dry gauze on the skin. This provides a slight spark gap to intensify the results. A pressure point style massage or manual lymphatic drainage style massage is most suitable for oily or acne skins, using an aromatherapy type blend or an oil-free massage medium. Completing the treatment with a soothing calming mask with acne-fighting ingredients like sulfur, kaolin, zinc, spirea and salicylic acid, and niacinamide will bring down any inflammation while treating excess oil production and breakouts. Loosen the mask prior to removal with a vac spray or the Dr. Lucas pulverizer with a fine mist of pulverized botanical extracts. This avoids the rubbing of the skin with sponges or your steam towel. It additionally rehydrates and soothes the skin at the conclusion of the treatment. No client should ever leave without a moisturizer and SPF protection. Apply and verbally introduce any treatment products at this time. Conclude your prescription and any recommendations in the retail area, and don't forget to rebook your client for their next treatment. Also check for any missed spots where their mask might still be applied to their skin. We wish you much success with your treatments for oily and acne skin. Be sure to log on to dermalinstitute.com for more tips, articles, and possible workshops on this topic. We hope you've enjoyed our webisode, and to receive a copy of the notes, fill out the short survey on the link provided. To find out more about the professional products that were used in this specific webisode on oily and acne skin, click on the link provided.